Good morning, guys. How are you? Hi. Hey, Elizabeth. Currently making an IV for a pregnant patient, actually. I'm going to be doing a immune drip for a pregnant lady. So just coming in this morning, getting that all set up. Hey, how's it over there in Illinois, Stacy? Is it cold? Where are you guys coming from? Yasmin, where are you coming from? Okay, so I'm going to be setting up some IVs. Are you going to NatWest Expo today too? No, I'm not going to NatWest Expo. I have a busy day today here at the clinic. But I saw that you were at NatWest, Elizabeth. Did you have a fun time? There's so much stuff, so much awesome stuff. For those of you who are just tuning in, yesterday I went to the NatWest Expo, which is the Natural Products Expo, and there were so many cool vendors over there. You just did full 2 days. That's crazy. Okay, so I can't imagine doing 2 full days. I'd be so tired. Coming in today for a push. Oh, cool. Come in. So yesterday I went to the NatWest Expo, and it's basically a bunch of natural products. There were a bunch of supplement companies, there were a bunch of really awesome food companies, a lot of clean beauty products, super, super awesome. But yeah, it is so great. I'm happy that I got to go to the NatWest Expo, but now I'm doing IVs. It's a really busy IV day here today. So this morning I'm setting up a immune IV, which is a Myers drip cocktail, but I'm doing my pregnancy formula for it. So my regular Myers cocktail usually has a bunch of trace minerals in there, but when you're pregnant, it is not recommended that you do intravenous selenium. So I actually take the selenium out, but you still have the rest of the trace minerals in there to help support immune function. So what's in there is going to be the vitamin C. And then the trace minerals I'm going to be putting is magnesium, zinc, but yeah, those are the main 2. And then I'm going to put in some B vitamins in there as well. So the B vitamins that I'm going to be doing is the B complex. So the B complex basically is the foundational Bs at the end of the day. So you get all the Bs, but then I like to put boosters in it as well. So I put a booster of methylcobalamin, which is methyl B12 or activated B12. And then I put in a booster of dexpanthenol. So dexpanthenol is vitamin B5. It's really great for adrenal function. And if you're stressed out or tired, like if you went to NatWest Expo for 2 days, the dexpanthenol is going to be really awesome. And then there's going to be pyridoxal 5-phosphate, which is activated vitamin B6. So activated vitamin B6 is really good for pregnant women, especially during their first trimester, because vitamin B6 actually reduces nausea. So if you're getting that morning sickness, this is going to be a really awesome thing to have. So yeah, I'm just got to clean up. But how is everybody this morning? Hopefully you guys are having an awesome Saturday so far. So for IVs, you always have to clean off the tops. It's called aseptic technique. The reason why I want to clean off the tops is just because you want to be clean as possible, right? So, like what I said, I'm doing an IV immune drip today for a pregnant patient, and I'm super excited to have her over. Usually when pregnant ladies come in for this IV immune drip, they're just feeling great. Not only do they get to boost their immune system, but they also feel very energized. And like what I said earlier, if they're experiencing any morning sickness, the vitamin B6 in this is going to really help them out. So a lot of people have been asking me how often they should get IV drips. So that's a really common question. Alrighty, see you later, Elizabeth. Yeah, that's a really common question that I've been getting on Instagram story. But it all depends on how healthy you are or how much support you need at the end of the day. So if you're pretty healthy, you honestly could get an IV drip once a month, once every 2 months. So what an IV drip will do for you when you're healthy is that it'll basically replete the body of nutrients that it needs. You can get it from your diet, sure. You can definitely get nutrients from your diet. But I also like to tell people if they experience any gastrointestinal issues, like healthy people can still experience gastrointestinal issues. Once that starts happening, I'm starting to think, hey Jordan, how's it going? Yeah, when people start experiencing gastrointestinal issues, I'm just like, hey, let's support the gut. But at the same time, there might be some inflammation going on. So let's do a little IV drip and see how you feel. Because at the end of the day, if there's a little bit of gut inflammation, it's going to be difficult to absorb nutrients. So it's all about figuring out what the best protocol is for you. So that's for healthy individuals. Also, athletes. Athletes are super, super healthy, but actually, when you're an athlete, you have high amounts of cortisol going through the body. And when you have high amounts of cortisol going through the body, it actually reduces the potential of your gastrointestinal tract to absorb nutrients. Athletes are actually more prone to get SIBO or IBS, which is really interesting to me. So if you're an athlete, you're going to benefit from an IV drip, honestly, just to get the nutrients at the end of the day. But like what I said, for people who are healthy, getting an IV drip once a month, once every 2 months, can be really awesome to support your health and wellness. However, if you need more support, you're going to have to come in more often in that month. So I have some patients who have Crohn's disease, IBD, ulcerative colitis. So all of those, they cannot absorb or will not absorb much nutrients about their or from their foods at the end of the day. So getting an IV drip is going to help replete their body at the end of the day. How about IV versus a lipospheric option? So for people who don't know what lipospheric is, it's basically a vitamin that is going to be encapsulated by a fat. When it's encapsulated in a fat or enveloped with a fat, it can passively go through the gastrointestinal tract, which is super awesome. And I actually do love lipospheric, or also liposomal, they're the same thing, liposomal supplements. But there aren't that many out there right now. But my favorite liposomal supplement is going to be coming from Live On. Designs for Health makes a really good one. There's a really great brand out there called Quicksilver. They make really, really great liposomal supplements. And I'm not financially tied with them at all. I just like them. And the thing that's really cool with liposomal supplements is that sometimes when you have a supplement like glutathione, it's best taken as a liposomal when taking it orally, because if you don't take it as a liposomal or a lipospheric glutathione, it actually gets broken down into the amino acids. It's 3 amino acids, and then when it gets broken down to those 3 amino acids, your body is just going to be like, hey, I have these building blocks. I could use it to make other things other than glutathione. So depending upon what your body needs, it'll shunt these resources to other biochemical processes to make other proteins other than glutathione. So if you do want to take glutathione orally, you want to take it liposomally or lipospherically. They're the same thing. What is the best time of day to take glutathione orally? Honestly, you could take it any time of the day. Yeah, I just tell people to take it any time of the day because it won't increase your energy at all. It's just an antioxidant at the end of the day. But there are other supplements you have to be very careful with, depending upon when you take it in the middle of the day or during the day. Like with B vitamins, I always recommend that people have it in the morning because B vitamins can give you a lot of energy. If you take it at night, you're not going to be able to go to sleep. And sleep is super important. So let me just formulate this IV really quickly, guys. Do you guys have any questions about IVs at all? Anything about supplements while I'm on? Anything about the Natural Products Expo that I went to yesterday? Guys, that expo was crazy. There were so many vendors or companies, so much free stuff. Got to meet a lot of awesome people and got to see people who I haven't seen in a while, like my friend Roy from Natural Stacks. I'm so happy I got to see him. I haven't seen him in a minute, but I'm so stoked that I saw him yesterday. Thanks for all the hearts, guys. So in this IV drip, it has 4 grams. It has 4 grams of vitamin C in there. So vitamin C is going to help support the immune system. It's really cool how white blood cells actually kill viruses and bacteria. I don't know if I've explained this to you guys before, but So the way viruses and bacteria get killed by white blood cells is that the white blood cell actually causes a peroxide reaction. A peroxide reaction basically means it causes bubbles to form. And when that happens, all those bubbles start dissolving the bacteria, the virus. And for that to happen, you need antioxidants. And one of the main antioxidants is going to be vitamin C. But you need other things with that, like some trace minerals to help increase the amount or regenerate the amount of vitamin C that's being formed in the cell. I've never had a vitamin IV. I don't know anyone in my area who does it. Oh no! What area are you in, Stacy? Comment below. The Thirlby, we were at the East one, and it's a total workout. Oh my god, yes. It is huge. I didn't know that there was a Nat Products Expo on the East Coast. Hey, Addictive Wellness! Oh my gosh, so I was eating Addictive Wellness all day yesterday because I was trying to survive with energy. And I was like, I'm eating all this food, but I also don't want to have a bunch of sugar because I'm doing a candida cleanse. So I was just eating a bunch of Addictive Wellness because it's sugar-free and it tastes delicious. Near St. Louis. Oh. Yeah, I don't know any naturopathic doctors over there in St. Louis, unfortunately. Man. So there's a website called naturopathic.org. It is the American Association of Naturopathic Physicians official website. So if you actually go to that website, they have a directory of all the naturopathic doctors in the country. So if you go there, you might be able to find a naturopathic doctor in St. Louis who provides IV therapy. I love you too, Addictive Wellness. I haven't seen you guys. How are you? I hope everything is well on your end. I've been watching you guys' videos. It is super cool. Yes, Sage and Ana Blanca. You're the best, Dr. Ryan. Thank you so much for sharing great insights and knowledge. Oh my gosh, so actually, thank you. So I've been telling everybody about blue butterfly because of you guys. So for those of you who don't know what blue butterfly is, it is this really beautiful flower, and it's super high in antioxidants. And it's a really awesome blue color, and you could find it in Addictive Wellness chocolates. So check it out. I think it's in their beauty chocolate, but check it out. Check it out. Check it out. So I just pulled up the trace minerals and the vitamin C. Now I'm pulling up the B vitamins. So I just did dexpanthenol, and for those of you people who are just tuning in, dexpanthenol is vitamin B5, and vitamin B5 helps support the adrenals. So if you're chronically stressed out, your adrenals get taxed, and if you're chronically stressed out, cortisol levels from the adrenals actually suppress the immune system. So we want to support the adrenals as much as possible. So what vitamin B5 does is that it actually reduces the brain's potential to activate the adrenals. So if you're stressed out, it sends out this molecule called ACTH, and it goes to the adrenals. It's basically like a text message from the brain to the adrenals saying, hey, make cortisol, we are stressed out. So with vitamin B5, it actually reduces that actual text message at the end of the day. So you won't be sending out cortisol levels, and you won't actually feel as stressed. So Addictive Wellness, yeah, going great. We're going crazy hard, but it's an amazing adventure. So stoked you're enjoying the blue butterfly, and thank you for sharing about it with others. So kind of you. Yeah, definitely. Guys, check out Addictive Wellness. They are super awesome. And I'm actually obsessed with their cocoa powder. It is so good. I like to put it in my CBD hot chocolate. For those of you who don't know about my CBD hot chocolate, check it out. The link is in my bio. It is delicious and sugar-free. So the next thing that I put in was vitamin B6. I use activated vitamin B6 called pyridoxal 5-phosphate. And earlier I was speaking about the benefits of vitamin B6, and I'll re-explain it right now. So vitamin B6 can really be helpful for hormonal imbalances. It can also be really helpful for protein metabolism. Other thing it can be really helpful for is nausea, especially during pregnancy. So this, if you're pregnant or know anybody who's pregnant and has morning sickness, vitamin B6 is going to be really great for them. Also getting an IV would be really good for them too, or getting a vitamin B6 shot. So the next one is going to be methylcobalamin that I'm going to be putting in. So I use activated B12, which is methyl B12. Let me just draw that. Great. So these are all the vitamin B boosters. I'm going to get the actual B complex next. Oops. Do you guys have any questions at all concerning IV drips? I'm here. So I'm pulling up the B complex right now. So the B complex is all the B's in them. Cool. And then over here in the clinic, we use lactated ringers. So there are a bunch of carrier fluids that are used for IV drips. So sterile water is a very common one that just doctors love to use. Sterile water is great. It's a really great carrier. It's cheap. It's awesome. Just good. But I like lactated ringers. The reason why I like lactated ringers over sterile water is because it has saline in it. Oh, that's another carrier fluid that some doctors will use, saline water. It has saline, but it also has electrolytes in there. So it's kind of like really nourishing to the body. I like to think of it as like Gatorade, kind of. You get all these electrolytes, plus you get hydration. And then with these added nutrients, it's basically just like super nourishing to the body, you know? So let's do the minerals first. So we have antioxidant minerals in combination with magnesium in here. So the antioxidant minerals are going to help alongside the let's do this first. They're going to help alongside the vitamin C that I'm going to be putting in to help with immune function. And then the magnesium also helps relax the body. So if you're stressed out, magnesium will help you out. This is like, whenever I do IV drips super fast on some individuals, they start to feel too relaxed, and it's kind of interesting. Some people tell me it can be kind of intense, but at the same time they like the feeling because they're able to relax at that moment. But magnesium is also really great for heart health. Magnesium is also really good for the development or the production of certain neurotransmitters that relax the brain. It's called GABA. So that's the first thing I put in. And then the next one is going to be vitamin C. And like what I said, this has a couple grams of vitamin C in here. It has 8 grams of vitamin C. And the vitamin C is what's going to be used by the white blood cells to cause peroxide reactions to kill viruses and bacteria. So Stacy, how do people usually feel after getting an IV drip? Yeah, definitely. So I spoke about the magnesium and how some people can feel very relaxed. So if you go really, really fast, because magnesium tends to work really fast in the body. However, there can be the B vitamins in here. So the B vitamins actually energize individuals. They get a lot of energy after they get the IV drip. So if we go slow, not slow, like moderately fast, people will feel less of like the relaxation and more of the energizing effect. But yeah, that's what tends to happen. So the next part is going to be the B boosters. So there's going to be vitamin B5, B6, and B12. It's like ombre. That's pretty. And then this one's going to be the B complex. Cool. So Stacy, you said, do you check blood work before doing one of these to see what exactly is needed? So you can do that. So there's a thing called a Nutri-Eval that I do, and it's basically a blood test. And that blood test will basically tell us what nutrients you're deficient in. However, if you don't want to get that blood test done, a lot of people just book an appointment for an IV drip, and this is what I usually tell them to get, because it's going to be the most nutrient dense at the end of the day. But if you do decide to do testing, like what I said, it's going to be the Nutri-Eval, and then you could do a customized IV drip, and then a lot of people do that with me as well. There are other things that you can, so there's other drips that I do in office that actually need testing as well. So I do high-dose vitamin Cs. High-dose vitamin C IVs are really good for immune function, can be really helpful for chronic viral infections. But with high-dose vitamin C, you have to get a thing called G6PD tested. If you have a G6PD deficiency, it's going to be very unsafe for you to have a high-dose vitamin C IV. High dose usually means anything more than 10 grams. So get tested. And like what I said, it helps support the immune system. And I absolutely love my high-dose vitamin C formulas for people who have chronic viral infections, like when they have mono and they've had chronic fatigue because of mono. This is going to basically kill the virus called EBV. But then if you have other viruses called CMV, HHV, so many other viruses, it's going to help reduce your viral load at the end of the day. Stacy, very cool. Thanks for all the info. Yeah, definitely. If you have any other questions, keep on commenting down below. I'm just going to keep on getting this IV set. So, next part is just tubing. And then another common question to get about IVs is, how long does it take? So, like what I said, it could be fast, it could be moderately fast. Moderately fast usually means 45 minutes. The fastest IV that I've done was 20 minutes, and so it could be 20 to 45 minutes with a 500 milliliter bag. If it's going to be a 1,000 milliliter bag, expect that treatment to be twice as long. And then another common question that I get is, what kind of IV should people get? So I usually tell people just to do a Myers cocktail, especially if they've never gotten an IV vitamin drip in the past. And like I was saying before, I recommend the Myers cocktail, which I also call the immune drip in my practice, because it's the most nutrient dense. it's going to be the most nutritionally comprehensive IV drip at the end of the day. And it also, like what I said, it supports immune function, it supports adrenal function, it supports stress response, it can support nausea during pregnancy, it can support hormonal imbalance because of all of the nutrients that are being put in here. It's super cool. I'm going to put this over here for the patient. So this is the IV lounge too, guys. So the patient usually just chills over there on the couch, and I give them the Wi-Fi password, even though it's only going to be for 45 minutes. I want them to be comfy. But yeah, that's the IV drip, y'all. So today, you saw that I'm going to be doing an IV drip, but I also got some consultations, and I'm doing a PRP facial today. So I'm going to be setting up for that. What else? I'm really stoked for the PRP facial. It's always fun to do that. So what a PRP facial is, for those of you guys who don't know, it's also called the vampire facial, which is also now being called the blood facial. So the PRP facial is basically the use of your own blood to make a nutrient-dense serum, which is then microneedled into the face to stimulate collagen production, reduce the appearance of fine lines, wrinkles. It can also reduce the appearance of dark spots, and also increase, it could kind of fill in the lips, and it could also fill in brows as well. What can it also do? Oh, it's also really helpful for acne scars. So for acne scars, you have to come more often compared to what's usually recommended for PRP. So PRP is usually 3 treatments, and then it lasts for 2 years. But yeah, PRP is awesome. And it's like what I said, it's the use of your own blood to make a serum or a nutrient-dense serum to basically activate collagen production, but it also recruits stem cells. It's really interesting. Cool. Ooh, gotta date that really quickly. Guys, have any other questions for me? How is PRP better for collagen production than a vitamin C product? Yeah. So what's the date today? Today is the 9th. I just gotta date this really quickly. Okay. So, are you talking about oral vitamin C, topical vitamin C? Can you clarify with me? Because I could explain. So anyway, vitamin C is a cofactor that's used by fibroblasts. Fibroblasts are the cells that are found in the skin to basically produce collagen. And like I said, it's a fibroblast to produce collagen. So if you take it orally, you need to be taking at least 10 grams every day for a couple weeks in combination with vitamin C. So lipospheric and topical. Okay, cool. So, like I said, it's going to be a cofactor that's needed by the fibroblasts to make collagen. Takes a while, but it can happen. So I actually tell people to supplement with vitamin C alongside bone broth to basically support collagen production before their IV drip, because you want to make sure, before their PRP facial, because you want to make sure that the nutrients are in the skin. You can also do topical vitamin C as well. Topical vitamin C won't be as helpful for collagen production. It's going to be more helpful to reduce the appearance of dark spots. That's what it's mainly used for. But yeah, I would do oral vitamin C so that you nourish the skin nutritionally, and then we're going to do the PRP facial. So the PRP facial is going to activate those fibroblasts or those cells to make the collagen at the end of the day. So it's like you have the nutrients in your skin, and then we're going to use the PRP to activate those cells so that they get the nutrient and make the collagen. I hope that makes sense. But let's see. Stacy, what about the facial for facial redness? Yeah, so you can use the PRP facial to reduce facial redness. So trying to figure out what the other root causes are for facial redness is going to be really important. Because if you do a PRP facial for facial redness, it's just going to be a band-aid to the situation. So if people if people have rosacea, that's usually telling me that there's a gut issue that's happening. And I like to think that the skin is a reflection of the of your inner health, or what your organs are, how your organs are functioning. And like what I said, when people have rosacea, it's whenever I put them on a certain gut protocol, protocol, the redness tends to go away much better compared to a PRP facial. But there are some people who do use PRP facials to reduce redness. Hopefully that helps. I feel like I explain things in a lot of words, guys. Just throwing the needles away in the sharps container. The Thirlby, it's so multifaceted. Yeah, so my approach is definitely multifaceted because I like to, especially with aesthetics, I like to make sure that the body is nourished, so that you have a really great foundation for skin health. And then I like to do topical treatments with that, so that those foundational treatments work faster. You get you get your skin, you get to reach your skin goals faster. Cool. And that is my first IV drip of the day, guys. Later on, I have a high-dose vitamin C drip I'm going to be doing for a patient. Is going to be an antiviral high-dose vitamin C. And like I said, I'm doing a PRP facial today. And then I got 2 consultations today, too. I'll take it with me so you guys get to see how I set up for the PRP facial. So with the PRP facial, it's usually the whole entire treatment is going to be 90 minutes long because it takes a while for the topical anesthetic to kick in. It takes 45 minutes, like I said. And then you got to do a blood draw, and then the actual microneedling part takes 30 minutes. Cool. So this is the microneedling pen, guys. Here's a company called MD Pen. This is it. And then you just put the, this is, sorry, pause right there. But yeah, you guys just saw the microneedling pen. So the patient usually comes in with a clean face, and I tell them to wash their face. So I provide the face wash. And then we apply the topical anesthetic. It's going to be for 45 minutes. And then we clean it off. And then we do the microneedling. And while we're waiting for the skin to basically, while we're waiting for the anesthesia, topical anesthetic to kick in, we also do the blood draw. And that's when the PRP extraction is actually done. It's really fun to do the PRP extraction. This is a topical anesthetic that I use. It's called BLT. Great. Do you guys have any questions at all for me? Just getting ready for my day. If you guys don't have any other further questions, I might be signing out. Hopefully you guys learned lots of cool stuff. I talked about IVs. I talked about nutrients and vitamins, what they're indicated for. I talked a little bit about skin health. We talked about PRP. We talked about topical vitamin C, oral vitamin C, liposomal supplements. What is your favorite natural moisturizer? I'm currently using jojoba oil because I just like it. But there are awesome brands out there that make really cool moisturizers. One of my favorite clean beauty brands is going to be Evan Healy. They're out of San Diego. Really clean, really great. The price point can be kind of steep. Another really great clean beauty brand is going to be Acure. I don't know how to pronounce it. They make really awesome clean beauty products as well. But yeah. That's my favorite moisturizer. Thanks for tuning in, guys. If you guys have any questions, DM me. And I should also tell you guys that if you and 3 friends schedule an IV drip, you guys get 20% off all your IVs. It's more than just drips, actually. It's going to be IV drips and IV pushes. So schedule. Tap the link in my bio to schedule. There's the full menu, or my full IV menu is also in the link in my bio. So check it out. Tell people. Thanks, guys. Have a good day. You guys are awesome. Bye.